Want to go now to Dr. Bernard Ashby, a cardiologist in Miami. He is also the Florida State lead of the Committee to Protect Medicare. Doc, thanks for joining us.
Thanks for having me.
Let's talk about the overhead picture here. You have 5 million coronavirus cases at this point, and 5 states making up those infections. California, Florida, Texas, New York, and Georgia, the majority of those infections, of course. What is happening here?
So just to be clear, your question is, why are we still increasing our rates of infection? I wasn't clear on your question.
Yeah, I mean, because you have 5 states making up just under half of all the infections across this country, right? So why is it that you see these clusters of cases increasing in these particular areas?
Well, I can only speak for Florida because I live here. And basically what we have is a lack of a comprehensive strategy. Essentially, what you have is a governor that looks at this pandemic from an economic perspective rather than a public health perspective. And therefore, we don't have comprehensive plans in place, such as testing, not just testing, but rapid testing, meaning test results within 24 hours at least in place, contact tracing and quarantine protocols. In addition to that, we have basically conflicting messaging coming from the top down. And essentially, we just need to get on one page. The fact that mask use was a controversial topic is insane to me. So things like that need not happen. So we just need to get on the ball and actually treat this as a public health issue, and we'll do better. But, you know, it begins with our leadership.
So it's so interesting because I've heard this over and over, right, from healthcare professionals, especially scientists, the lot, where essentially you're saying we need to get on one page. We need to have a national message. We need to have one message in order to mitigate the spread of this thing, the spread of the coronavirus. It has got to be frustrating for a health professional like yourself to be watching the spread of this disease, so many folks getting infected and dying, and knowing that it comes down to, in a way, simple messaging, in a way, kind of unified messaging for Americans to understand the threat and to know how to protect themselves.
Well, it's frustrating as an understatement. I mean, when people die, I get pissed, especially when it's my family, my patients, my community. I get pissed. And so when it's unnecessary and it happens because of poor leadership, poor choices in decision making, it's especially frustrating. So essentially, what we want from the healthcare community is for our leaders just to listen to the science, listen to the folks who do this for a living, and apply these policies in a comprehensive way. Let me give you an example. There's a big debate about testing, right? And we're always saying either testing isn't happening or testing is happening. Essentially, what we're saying is, listen, if you test somebody, get them the results in 24 hours. Why do we have a national strategy for vaccine development, yet we don't have a national strategy for containment of the pandemic? It makes no sense. And that lets you know where our priorities lie, because the leaders who are running our country is looking at this from a purely economic standpoint. And if you looked at it from a public health standpoint, that solves all of the economic issues. If we deploy testing that gives us results within 24 hours, but better yet, within 30 minutes, because that technology does exist, it's just that our leadership hasn't taken that by the mantle and basically distributed it to the entire country. And so that needs to be a focus rather than the development of vaccines, which is important. But to me, controlling the pandemic and the infection spread is actually more important and more urgent at this particular juncture.
Dr. Bernard Ashby, thank you so much for your voice on this.
Thanks.
Really do appreciate
Thanks for having me.
You joining us today.